Friends and colleagues, agreeing on a blueprint to deliver the Sustainable Development Goals is simply mission critical. I very much welcome the rich discussions that we are having here this morning. At Gavi, the Vaccine Alliance, we often say that while what we do is important, it is how we do it that leads to lasting impact. And I'd just like to draw your attention to the fact that you can find more about the model for the Gavi Alliance on the website, and also want to thank Japan and the private sector for mentioning the role of Gavi, the Vaccine Alliance. Gavi was created in 2000 with an MDG-inspired mission to help save children's lives and protect people's health by increasing access to immunization in poor countries. The Secretary General, Ban Ki-moon, speaks of Gavi as a leading example of a truly global partnership that is delivering specific results. Let me share with you some reflections on our experience in multi-stakeholder partnership and financing that may inform how we implement the post-2015 agenda. Gavi is a unique public-private partnership created to bring together the best of what key UN agencies, governments, the vaccine industry, private sector, and civil society had to offer in order to improve childhood immunization coverage in poor countries and to accelerate access to new vaccines. By 2015, Gavi has reached 500 million additional children since its creation, preventing more than 7 million deaths in the process. The mechanism we put in place to ensure meaningful and inclusive participation of our stakeholders is exemplified by our multi-stakeholder board, which helps ensure partner collaboration and increased accountability. But one lesson from Gavi is the need to ensure more equality in intergovernmental discussion. For example, we have had to explore ways of trying to ensure that the voice of developing country governments is being heard. After all, the 5 ministers of health who sit on the Gavi board have a day job to run their own health services, whilst the 5 donor government representatives on the Gavi board, their day job is to manage ODA contributions, including to Gavi. Now let me move to financing. Globally, we recognize that we need strong ODA commitments, innovative mechanisms to leverage ODA more smartly, and we also need domestic financing. Gavi combines all three. The vast majority of Gavi's funds come from governments as ODA. Donors have been attracted to Gavi because we help countries to achieve real and measurable results, children's lives saved and illness averted. But they are also attracted by our business model and approach to innovation, including in innovative finance, where we make smarter use of ODA commitments. One of the key innovative initiatives launched by Gavi is the International Finance Facility for Immunization. IFIM, as it is known, is one of the most successful innovative financing tools of the MDG period. It has leveraged official development assistance to raise more than $5 billion in the capital markets over the last decade through the issuance of vaccine bonds. We are honored that the mission of Australia and Liberia to the UN are hosting a briefing tomorrow at 1:15 p.m. in the conference room D on Gavi's experience with innovative financing mechanisms. I invite you all to attend. Secondly, through Gavi's co-financing policy, all countries contribute a share of the cost of new vaccines, which gradually transfers responsibility for funding the vaccines to the government. The co-financing share of the costs are determined by the government's ability to pay, which adjusts as a country's economy grows. Finally, the Alliance has an explicit focus on market shaping. The 73 countries to which Gavi offers support make up 60% of the children born around the world each year. By aggregating that birth cohort and by bringing together large-scale donor financing, we are transforming the global vaccine market to the benefit of the lowest income countries. By bringing private and public sector partners together, leveraging ODA in smart ways, and taking a market-based approach to development, we are seeking to ensure sufficient supply of appropriate quality vaccines at low and sustainable prices. Gavi is looking to accelerate our efforts over the coming 5 years and expect to help developing countries to immunize an additional 300 million children, leading to 5 to 6 million lives more saved. As we reflect on the SDGs and the Post-2015 development agenda, we invite member states to look more closely at the experience of Gavi's 21st century development model and think of how to build on the lessons we have learned and apply them to other development challenges. Thank you.